Hello, pharmacists and friends. Today is April 17th, 2023. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen to find out how pharmacists and pharmacy students like me can improve population health, health equity, and patient care through advocacy and education. My name is Brindley Rosepars, and I am a final year pharmacy student at the University of Rhode Island, working alongside the Rhode Island Department of Health with my professor, Dr. Bratberg.
Howdy, everybody. I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research here at the College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Thank you, Dr. Bratberg, for that introduction. So on deck for our listeners today is a conversation on misinformation, and more specifically, the practical solutions that are needed to be able to address misinformation in our communities. We'll be discussing how pharmacists can teach others about how to find credible sources, how to identify if a video, news article, or other content is valid or truthful, and lastly, discuss the most practical solutions to dealing with misinformation. We are also delighted to be joined by Dr. Caitlyn Blake today, a PGY2 medication use safety and policy resident at the University of Utah Health. Dr. Blake is an alumni of the University of Rhode Island College of Pharmacy and completed her PGY1 residency at Christiana Care in her hometown of Newark, Delaware. And just of note for our guest, the following podcast does represent Dr. Caitlyn Blake's own opinions, and she is not speaking on behalf of the University of Utah. Dr. Blake, please feel free to introduce yourself and tell our listeners a little bit about you.
Thank you so much for having me, Jeff and Brindley. Like Brindley mentioned, my name is Caitlyn Blake, and I am the current PGY2 Medication Use Safety and Policy resident, otherwise known as MUSP resident, here at the University of Utah Health in Salt Lake City, Utah. I'm originally from the East Coast, and during my time at University of Rhode Island, I was also on the NCAA Division I swim team. So I had a lot of sports background while in school. After graduating, I went back home to Delaware for my PGY1, and then I made this big move out west for my PGY2. And I will be staying out here post-graduation from residency, which is super exciting.
Congratulations. Salt Lake is one of my favorite places. I've been out there for some conferences and things and went on, I attempted and completed several hikes, but always look forward to going out there.
It's absolutely gorgeous out here. So actually during my residency this year, it's largely drug information as well as medication safety. So kind of those two components are largely a part of my residency. And I actually have a really strong passion for medication safety specifically that I got during my final year APPI rotation, where I was on rotation at Rhode Island Hospital. So very strong med safety passion. However, I don't think drug information and med safety are silos. They very much overlap, especially as a lot of our drug information type of questions have a very strong patient safety and medication safety theme and focus to them. So outside of my residency and work, we have a resident kickball team. We were our division champions in the fall, starting up the spring season here shortly. I also love enjoying and exploring new bakeries and coffee shops throughout the city, as well as I even learned how to ski this year with our record-breaking snowfall out here in Utah. So that's a little bit about me.
Caitlyn, thank you so much for that introduction. And there is so much I feel like we have to chat about. To our listeners, before we started recording, we actually just found out that both Dr. Blake and I completed the same medication safety rotation during our time at Rhode Island Hospital. And that was definitely one of my favorite rotations. So it's so great to kind of see your experience going through that rotation and now being so heavily involved with that through your residency. And as someone also interested in drug information, seeing you in your role, being able to combine so much of that. I definitely agree. Those are not two siloed professions. They definitely have a lot of interaction together. But I would love to hear how Utah is treating you and how skiing for the first time was.
Yeah, Utah is great. I mean, everywhere you look, you kind of see mountains. So outside my window right now in my office, I see mountains. The view from my apartment, mountains. It's just a great environment. Lots of parks and everything to walk around. So really getting that outdoor experience. Skiing for the first time, definitely fell a lot. Had to pick myself back up multiple times. And one thing that I wasn't really aware of was while we were there, they were doing avalanche mitigation. So we were hearing all of the C4 dynamite go off and echoing throughout the valley. So that was quite interesting. It was not at the resort, so not in any avalanche danger where I was at.
That is wild. I actually just learned how to ski for the first time too. A couple months ago, I was in Alaska for 2 months on rotation, and I had also never been skiing before. And it finally came to the time where I was like, it's time. We got to learn this. What other better place to do it? And I also had a pretty rocky start, but was able to get on my feet. So that was definitely good. I'm glad that it's nice to meet other adults skiing for the first time.
Yeah.
So yeah, once again, Dr. Blake, we are so happy to have you here today and to be able to get your opinion as a specialist in drug information and medication safety as well. So to start off with our first question for you today, as a drug information specialist, what kinds of requests are you responding to in your work? Are these like internal or external requests? Are these questions from physicians, patients, pharmacists, or other providers?
Our drug information call center services mainly the University of Utah, both the hospital as well as the university. So a bulk of our requests do come from internal staff. And so just for a little bit of size reference, our University of Utah Health consists of 5 hospitals. We have 12 community healthcare centers, numerous institutes and centers covering a wide range of different disease states. We also have a cancer research group. We have an NCCN designated cancer hospital, and as well as all of our schools and colleges for public health within the University of Utah. So a very large system, lots of staff members that have our contact information that can give us a call or an email with questions. Mainly we get questions via email. We do have a physical phone line, so we do get physical phone calls as well. These requests come from everyone. They come a lot of pharmacists, a lot of physicians, a lot of nurses, research students, and occasionally we will get calls from community members related to their medications. Those are a little bit less frequent, but they do happen. We also do field external questions from healthcare providers regarding drug shortages. So at the Drug Information Service here at the University of Utah Health, we help update the ASHP drug shortage website. So we do get contacted regarding some of those drug shortages. So we help triage those and get them to the appropriate people that are working on those shortage postings. In terms of types of questions that we get, really anything you can think of, we can get a question on. So we get a lot of questions with assistance with literature searches, investigation into adverse events with medications, temperature excursions for drugs, and if they're still able to be used, drug-drug interactions. We get a lot of chemotherapy and natural product interactions from our various oncology groups, alternative therapy for patients, and we also get a lot of policy clarification questions. So the Drug Information Service handles all of our pharmacy policies. So if there's any questions and updates needed, we field those as well. So never know what you're going to walk into when you go into a call center shift.
That is so interesting. And it sounds like you really have such a wide variety of requests that you're able to help manage. Going off of that, do you ever receive drug information questions that may be related to any sort of medical misinformation?
So we may get questions related to medical misinformation. They don't necessarily come across that this was a misinformation type of question. Sometimes we can kind of tease that out based off of if we get a question in from a provider, kind of in that call intake and explaining a bit of background, the provider may say, oh, I received this question from a patient. Mm-hmm. And so we can kind of figure out some themes of maybe there was some misinformation there. We don't necessarily receive like direct links to different websites or social media posts saying, is this accurate information? Kind of along those themes of medication misinformation, we do receive quite a lot of questions on chemotherapy and natural product interactions. And so as we're doing our research into these natural products and trying to get the ingredient lists, we're going onto a lot of the product websites. And so as we're going through those product websites looking for the information, I do see a lot of misinformation that are posted on those websites with different claims and things of that nature. So in those cases, we really try to do any interaction checks that we can. We use a lot of natural medicines for those interaction types of checks. And then we make a summary, we send it back to the provider, and then that provider has a discussion with the patient on risk benefits of taking these products with their proposed chemotherapy regimens. We aren't necessarily directing the patient or contacting the patient directly with that information, but we do see a lot of that in the research component.
It's interesting because, I'm sure there's a difficulty in that you see these claims that could be harmful on these websites, but you're just researching it. Do you have any sort of responsibility, in finding those things and correcting it? Is there, you have a policy background. Do you contact the folks? Do you contact FTC or FDA about claims? Like, what's the process when you find that misinformation on those websites?
Yeah, so a lot of times we just don't quite have that bandwidth to be able to contact every single company directly to let them know about if there's any misinformation that does come up. If we do see misinformation a lot of times on our tertiary references, or if there's confusing information, we will contact them directly, since we know that a lot of healthcare providers are using that. But we just don't have that bandwidth to contact every single company, contact the FTC when we do see that misinformation, unfortunately.
Yeah, I feel like that's such a struggle in today's day and age, is that there is so much information out there. It really is an overload. And with how much misinformation we are seeing, sometimes it could be hard with whatever we are already dealing with in our busy lives as pharmacists and pharmacy students and whatever profession you're in, to really be able to attack it from the root of its source. And so I think that's a great lead into our conversation today about being able to help others navigate this world of misinformation that we live in. So to really kind of start off and talk about kind of the history of misinformation and where we are today. So we know, as pharmacists and pharmacy students, we frequently encounter many drug information questions from so many various sources. So whether it's a text from family and friends, whether it's a patient in the community setting or even ambulatory practices, or you're in a drug information call center like Dr. Blake here, many of these questions, especially from those outside of healthcare, may come from a place of misinformation. And just to review the definition for the U.S. Department of Health and Human Services, misinformation is information that is false, inaccurate, or misleading according to the best available evidence at this time. And so this is a really important topic that we're discussing today. Notably, in 2021, the U.S. Surgeon General released an advisory report on building a healthy information environment. And this is really interesting because notably advisories are reserved for significant public health challenges that need immediate awareness from the public. And so it's clear that just by the fact that this report exists, that we are facing a real challenge from misinformation, particularly during COVID-19 and even times beyond that. It's been a struggle. And this is something that can be found in so many places, whether it's coming from advertisements, social media posts, the news, even group chats or online forums. And a lot of these challenges with misinformation, specifically relating to health, heavily circulate around topics such as vaccines, infectious diseases, and even products like supplements or natural products that Dr. Blake, you were saying you work closely with. So let's start off by diving into kind of source analysis. And really, how are we able to identify credible sources for health information? So something to think about here is what kind of sources are most likely to be sought out by different populations. So whether they're a healthcare worker versus non-medical personnel, by age as well, we have people that are older adults seeking out different versions of news and information rather than Gen Z. So I'd love to get your thoughts on this, Dr. Blake, about identifying credible sources.
Yeah, so I definitely think that, especially for our general population, determining if a source is credible can be especially challenging for our non-medical personnel and also those with low health literacy. It's a challenge that can be faced by a lot of people. In terms of our healthcare professionals, I would like to think that they're using our primary literature, published guidelines to make evidence-based recommendations. And then for our pharmacy colleagues and also our medical professionals, for information specifically regarding medications, we have numerous tertiary literature databases and compilations that they can easily access to help gain or get that information quickly at our fingertips. So thinking things like our AHFS, drug monographs, Lexicomp, Micromedics, those sites those sorts of sources. Those are typically reserved for our healthcare professionals. For our community members, they might not have access to this, or they might not really understand what those sources are. So kind of thinking about our different generations, I think that the older adults generally look more towards print news, magazines, TV commercials as they're watching the news for health information. Our older generations might not be on social media as much as our younger generations. So kind of our millennials and Gen Z have some overlap with kind of the social medias that we use. So Facebook is a large area for information that people get. A lot of people just do Google searches. You have TikTok, Twitter, Instagram, all of the social medias. Reddit is probably in there too. So just a lot of different information sources. And a lot of times there's advertisements directly from companies, as well as sponsored posts that we just have to really work on trying to tease out where all that information is coming from. So great thing about the internet, vast wealth of information at our fingertips. However, that also comes with a lot of misinformation. I'm kind of reminded of that. There was a TV ad. I don't remember what company it was for, but it was a conversation. And one person says, "Where'd you hear that?" The other one goes, "The internet." First person, "And you believed it?" Second person, "They can't put anything on the internet that isn't true." That's not the case. Lots of misinformation is put out on the internet. Interestingly, the FTC actually just last week issued a warning to about 700 pharmaceutical, retail, and health and wellness companies that market specifically over-the-counter drugs, dietary supplements, homeopathic products, and health foods regarding potential civil penalties that they face based off of the advertisements containing claims that they cannot be backed by reliable evidence. So this was just last week. The list of all of these companies is public. So it's really interesting that the FTC is actually now starting to try to crack down more on this health misinformation. Yes, Jeff, I saw you go off mute.
Oh, it's this breaking news is what makes the regimen so important as part of everyone's media diet, I should say, as we're talking about things. So I'm curious, what is the FTC, or do you know, like, what's the accountability? Because can they just put their website in a different country? There's a lot that people can do to keep pumping that information where their consumers are going to find it. So, it's a long list. It's public. I'm sure the list of those companies is not what people are searching or finding if they're searching for information on the internet. But what are those civil penalties? Are they large enough that it's worth to not put out misinformation? What do you think?
So I think it's going to be company dependent. So some of these companies are very large pharmaceutical companies. These civil penalties are upwards of, I think, about $50,000. So these larger companies might still continue to have the information out there because that penalty is not that great. These smaller companies might have a little bit more stake in that actual dollar value could be difficult for them to pay. But from what I was able to kind of gather from looking at this FTC, the documents went out to the various companies, and basically it's a warning. They're not actually enforcing these penalties as of right now, but it's a warning that they're at risk of these penalties. So it's attempting a step in the right direction. It's a very large undertaking to go through and make sure everyone is following all of the proposed guidelines and laws. So I see it as a step in the right direction. I don't think it's going to change anything overnight, but it's more bringing awareness that this all exists.
Yeah, I think awareness is definitely a big part of it. And potentially this does have something to do with the Surgeon General's report as well, because that report, and for anyone that's not familiar with it, had different recommendations on what you could do based on what population you're in. So for individuals and communities, for healthcare workers, for large corporations and social media sites, and for governments as well. And so kind of going off of this, where you're now seeing kind of a crackdown on misinformation by the FTC. Something else we kind of saw populate from that Surgeon General's report was also some changes in social media use. And so I'm sure we all remember during COVID-19 when suddenly anytime you had a post with COVID pop up, you immediately got a link to the CDC guidance website, or we were starting to see fact checking on Twitter, perhaps. If there was a tweet that has been viral with very inaccurate claims, you're starting to see more bars on the bottom with corrections or helpful context for that situation. So I think it's really important to bring awareness to it. And it's interesting to see how different entities are reacting to this rise of misinformation, whether it's the FTC, whether it's social media sites. So it's very interesting to see the awareness being brought to it. So let's continue chatting about sources. So when you're evaluating a source, whether it's a healthcare worker or even someone in the general community, it's really important to think about what the source gains from publicizing this information. So thinking about, are they selling a product that they created? Is this a person that has an affiliate link that gets them a percentage of sales? Are they trying to create fear or any sort of other emotion? Or do they gain nothing other than providing accurate information, maybe healthcare information? So how do we communicate this point to other people in order to help them evaluate sources on their own?
So I definitely think that when we're evaluating, specifically with social media posts, looking to see typically for those sponsored or advertisement posts where an individual is being paid to give out the information, somewhere in the post it'll say sponsored, or there'll be hashtag ad. There'll be something indicating that this is a paid post. Other things that might kind of tip you off that this might be a paid post is, does the person sound very rehearsed and as they're reading off a script? So typically, if it's a video, our natural way of speaking isn't reading from a script. So kind of trying to determine, does this sound scripted? Does this sound real? Is there anywhere indicating that this is an ad? Also, they'll directly spell out the link of where you can get the product, whether that be in the comment section where you can just do a quick link, or if they're talking fully spelling out that URL. Ways to kind of get around it that I have found is, if you think that it's an affiliate link, go into a different browser and just search that website just on its own. So that way you're not going through that affiliate link, because there are things embedded in that URL to have that poster get that monies back from the company. So that's a kind of a way around that. As well as, there are times where the post might not be sponsored and the person is just giving their honest feedback on a product. It's their experience, their testimonial. That is their life experience. That might not be your experience with a product. So it's really important to notice that, especially in those testimonials, that is how that one person reacted. That's not how you might react. You might be taking a medication that's interacting with the product that they're trying to tell you about, that causes an adverse event. I think really for these source evaluation is critical in these cases. So if the poster is being paid, they'll say what the company tells them to say. They're not going to go and fact check that. They're not going to change the script. They're just going to tell you what they're being told. Typically, that's only the positives. They're not going to have any negative or bad information that makes the product not look great in there. So in those cases, go to the website, see where these claims are coming from. Are they coming from literature? Are there sources that are cited? Is it all coming from testimonial? We're kind of trying to tease out that information. It again is extremely difficult to do. And just the more you kind of start looking at these sources, the better you become at kind of identifying this. But honestly, when in doubt, ask a healthcare provider. We are great sources of information. Your community pharmacists are great to help lead you in the right direction of where good quality information can be found.
What a great way to summarize this point. I think reaching out to your accessible healthcare professionals, which really are pharmacists in many cases, to help evaluate source if someone's feeling stuck or if they're just not sure. I think that's a great piece of advice. I remember one time I was on rotation at an ambulatory care clinic and I had been reached out to by a provider that had said, hey, my patient came in, they're really interested in taking this supplement. They just wanted to learn more about it and see if it would be a good choice for them. And that was coming from the provider. And I had gotten just the name of it. It was some sort of dietary supplement meant to help an individual lose weight. And they had of course, a beautifully designed website, very user-friendly, very easy to check out, very easy to subscribe and save. And so I think that's one great example of someone reaching out, because really what the evidence said is it probably won't help you lose weight. A lot of the people that were taking it were also doing it with diet and exercise. So with my honest recommendation of what I thought from the product and the literature, it may have saved this woman some more money, but it also was very affirming to know that there are some people that will go to their healthcare provider and still kind of check in on things, because I think that is important in this day and age. And so to kind of circulate back on the topic of social media and influencers and celebrities, we are seeing more and more of these people play a role in marketing strategies, especially for products like supplements. And so how do you think this impacts the way that people perceive the safety and effectiveness of these products?
Yeah, so I mean, as a consumer, if you are looking on social media, you have celebrities or influencers with large followings, and they are saying, oh, this is such a great product. I feel like the consumer will think, oh, yeah, this is great. It works. It works. I don't know about the safety component, because I don't necessarily know if a lot of people immediately think, oh, is this safe? More, as it's effective. As healthcare workers, we think of safe and effective together. So I think that it really just kind of will sway people to purchase the product, even though that influencer or that celebrity, they might not even be taking this product at all. They're just being paid to sponsor it. So kind of likening it to a non-healthcare analogy would be, you see a super popular product that's online. Say, for instance, a new hair dryer, hair tool, hair accessory, something like that. Everyone's raving about it. They say, oh my God, this is great. It'll work wonders. You are now influenced to purchase that product. You go out, you spend a large amount of money to buy this product. You start using it and you realize this is not giving me those same results. This is not working. I want to return it, but at that point you can't return it. So now you're out a lot of money. Mm-hmm. That's a physical object. Our health is not. We have to be careful with our health. So I think really when it comes to those influencers and things like that, really take your time, do your own research, ask questions to see if this is the right thing for you. Is it safe? Is it going to interact with any other medications I'm taking? Is it going to interact with any of my other current disease states? Is it going to worsen my diabetes? Is it going to worsen my high blood pressure? And just really those questions and talking to your healthcare providers is the best thing that you can do, especially in these situations.
Absolutely. And I think that's so great to also emphasize making sure that it's not interacting with anything else that's going on, whether it's a medication or a disease state that you have, because I feel like people so often forget that just because it's over the counter doesn't mean it's safe for absolutely everyone. I agree with what you said about people may perceive these targeted advertisements by celebrities and social media influencers being more effective, especially if it's something perhaps created by a celebrity. Like, for example, there is a new celebrity created supplement line where they're selling melatonin for $30. And so in those cases as well, I think you want to be very clear about even giving more instructions on 5 milligrams of melatonin can also be found over the counter for a significantly lower price, and it's probably going to do the same thing. So also kind of trying to protect consumers and our patients in that way as well, especially for those that don't have very disposable income as well. And so kind of moving on, in the past, it was very easy to look for quote unquote more credible sources through things like verified accounts. So if you were looking for the CDC or the FDA, those would be blue check marks accounts. But now that more and more people are verified on social media, how can we stress that verified may not mean credible, in your opinion?
Yeah, so going forward, I think this is going to be an increasingly difficult thing to determine, especially with the moves of many social media platforms to you can just purchase a verification, be it a monthly fee, a flat fee. anything to get that blue check mark. I think a good example to, if patients are really kind of not fully understanding that people can just buy a verification now, would to be when Twitter first started to offer just you can buy a blue check mark, lots and lots of fake accounts popped up impersonating real businesses. So one example was there was a post that was made under a fake pharmaceutical company advertising that the price of insulin was going to be capped. This caused a large stock plummet for that company, and then it was determined that it was not actually the company that posted that, it was someone impersonating them. So I think that's a great example of like, we just need to be careful with, just because we see a blue check mark does not mean that it's a verified account and may not be fully credible information. So a lot of times we can kind of determine that based off of looking at what the actual username is instead of just that title. So if it looks, they're using O's instead of zeros or zeros instead of O's, underscores in weird places, those are kind of tip-offs to this might not be the actual account. So really, we're just going to have to be much more careful and cognizant of these fake accounts that are posing as the real thing.
Definitely. It's such an interesting environment that we live in now where you can buy verification and really having these worries that there's going to be impersonations of large corporations or potentially government agencies online, and people may get led in the wrong direction for health information with these. So to kind of summarize our conversation that we've had so far revolving sources, what are the main points of advice that you would give to community members on determining the credibility of a source?
So kind of some main points of advice would be to, especially for online sources, is it coming from a reputable source? A lot of times our .gov resources, so cdc.gov, fda.gov, those are all vetted and have been reviewed. So those are great sources to find the most up-to-date and accurate information. Also looking for large nationally accredited organizations, so American Heart Association, things like that. Also, if those sources have peer-reviewed citations, those are great ways to determine kind of that credibility. Kind of on the flip side, if you see it's a blog post, if they're personal testimonies, if they're coming from forums, those are kind of like red flags that these might not be the most credible of sources. Not to say that all blog posts are not credible. It's more of a warning flag. For social media, does the person appear to be getting paid for what they're trying to sell? If yes, kind of doing your own research and determining if the product is, the claims are credible. And again, when in doubt, talk to your healthcare provider. If you have a question, ask a pharmacist or talk to your doctor. A lot of times there are online, like through online healthcare portals, contacting your doctor with an online question can sometimes be a great way to help determine credibility of these sources.
You know, it's hard to hear some of this stuff because we know how much our family and friends, and I look at students who bring claims to me, and I'm very, very happy to answer those questions. I'm sure it's frustrating because Brent and I were talking about how, you talk about the .govs and things, but people don't do that. We for example, you or I, maybe at University of Utah, and I'm sure in your company, Brent, that they require you to look at cybersecurity kinds of things. So is this a valid website? So it's sort of, that got in my head when you were talking about is it a valid website and a .gov? But then there are really official names for websites. I'm not going to say it here, but there's a vaccine website that is a virulent anti-vaccine website that looks beautiful and has very appealing claims. And Brent and I talked about that, the sort of the appearance thing. Or there'll be .coms who will have the same .gov name, and people don't know that they're at a site and they've never seen the original site. So that's the hard thing. And I think the other building thing, and this is a whole other podcast, we'll have to have you back in your permanent position, Dr. Blake, but is this idea of deep fakes, and AI, right? So answering these questions where it really sounds like a person, it looks like a person, I think it just shows the importance and really the emphasis here that I hear in your conversation, that talk to your doctor, talk to your pharmacist. And of course, as we always say on the Regimen, pharmacists and doctors and nurses and social workers all need to get paid to answer those questions. because people are running into legitimate problems on the internet doing things. I co-authored a publication of a person who almost died in the ICU taking a supplement for weight loss and had some almost devastating consequences and stayed in the ICU. The cost of that stay and the emotional suffering is really intangible compared to not confirming your bias by finding all these sites, and that's a national product. So you already identified many ways for people to sort of think about this. I sort of like to think about is, how do you get people to think before they actually do the search, right? How do we determine the validity of sources? So they may not know about a .gov, or they may not know all the 3-letter acronyms we use in medicine. They're on social media. It's not being corrected. They bought the verification. What are some sort of like take-home points our audience could have to say, okay, you want the truth, you don't want to get hurt. You talked about safety. What are some of those things that, like with individual pieces of information, to determine their validity?
I think that this is something that is difficult to kind of have a one-stop answer to, because each case is very much situation dependent. So for me, one thing that I always look at, especially when I'm evaluating articles, be those news articles, be those published literature that we're finding through literature searches and things like that, for our healthcare workers, is this a peer-reviewed article? And for our news articles, are they citing other sources? So are they citing the government agencies? Are they citing external news sources and things like that? Or is this a strictly opinion piece? So kind of looking to see that information. So for our consumers kind of reading news articles, are they linking out to other articles? Does this seem like an unbiased, or is this completely polarizing to one aspect of things? A lot of times when it's extremely polarizing, you're not getting the full story. You're only getting one side of the story. So you might have misinformation within that polarizing piece. Also, in those news sources, is it consistent information, or is it contradicting itself? So in the first paragraph, are they recommending one thing? And then in the second paragraph, they're recommending the complete opposite without acknowledging the fact that there's two sides of this. In terms of our videos, really just kind of, again, with that polarization, does this person almost seem upset about something and really wants you to buy into it? That is kind of, for me, a red flag of misinformation. Is they're really just trying to push their point, which may or may not be totally accurate. Again, red flags. In terms of infographics, so kind of thinking when we see charts and graphs and things like that, do they on the bottom of that chart say where they get their information from? If we're looking at, for instance, vaccine numbers, are they citing something from the CDC, from ACIP? Where are they getting their numbers from? Or is there nothing posted? And in that situation, I can't be for sure that they're not just making up numbers. So those are kind of quick things to look for when evaluating. Obviously, healthcare providers, we do look over things with much more of a fine-tooth comb. So there's nitty-gritties down in there, but kind of for our community members, those broad things of like quickly trying to determine, is this a valid source or not?
I think all people need to know that, is that we're just as deceived by all kinds of things. I get, again, think about the kinds of provider questions that both of you have, in your residency experience in Bryn and even in your rotation. There are a lot of people who believe what their patients or families or what they're asking for, and you want to help. And so there's an emotional component here, both in terms of, I don't have a lot of time. Maybe they don't have, by the way, world famous drug info, a medication safety site at U of U. It's a very prestigious place, the drug shortage location for the world, the nation. So, there's a lot of, I'm sure it's a very, very critical appraisal that you guys do there. But in other places, if you're in a place, maybe you don't even have that great access to the internet. What are people hearing? And they may not even have access to healthcare providers. So it's sort of the pharmacist, as we say on this podcast, maybe the only source of information. I think what I hear in those steps is really the way that we look at information, we can communicate to people to say, ask yourself, is this true? Ask if it's contradictory. Ask yourself how you feel when you see this website, and realize that on .gov websites, they may offer, here's what the evidence shows, but there are limitations. It's not for everyone. I was just putting a lecture together today, and it's sort of, here we recommend this drug, but here are the limitations for it. It's that kind of balanced information that I think shows you that it's credible. And the things like an infographic, is there a link? And one thing I wanted to point out is you talked about peer reviewed. So make sure do you want to explain what peer review to our audience is for articles?
Yeah, so peer-reviewed articles are articles that are going through the publishing process. So for instance, I am submitting a publication. In this process, the publication group that I put into will then send it out to Jeff, we'll send it out to Brindley for them to review and go over the information to make sure that it is accurate, it's not misleading, and also kind of helping with some of that more grammatical approach as well. So really editing a piece. And then Brindley and Jeff would send it back to the publisher. Publisher would compile all of those, send it back to me for final revisions, and you kind of go through that step. So it's really having other professionals taking a look at your work to make sure that it is accurate and not misleading. So it's kind of that peer-reviewed process.
Awesome. Well, thank you for that. And just to kind of add on, I think some other things potentially we could be telling people to look for whenever they're assessing the validity of any content that they're taking a look at as well. Also, I think does somewhat go back to the source or the author, particularly in news articles or wherever you do have a named author. I think it's really important to encourage others to assess if there's particularly any conflicts of interest present. So perhaps this person used to work for a company and now they're writing an article in favor of it, kind of just assessing where that author's intentions may lie. And then also questioning, does the author have the authority to be reporting on this topic? Is this a op-ed reporter putting out a regular non-opinionated piece on something in healthcare when they normally write about sports? So just something very general, which normally I feel like many news sources do let you click on the authors of articles and kind of see what else they've written before. But that's another really great tip to be able to assess if this is normally within the author's wheelhouse.
And another point just on top of that, kind of with that conflict of interest, specifically when healthcare providers are looking at trials and clinical trials that are bringing drugs to market, a lot of times those are funded by the drug company. Yes, we know that the drug company will want their drug to go to market, but without that funding, a lot of times these studies just don't happen. And so for innovation and furthering medical advancement, we may need those studies that are funded. But we just need to really make sure that we're reviewing that funding to see what aspects were they involved with. Were they involved with the study design? Did they run the statistics? Did they help with the publication and authoring and things like that? So you just kind of need to, specifically with those controlled trials and trials that bring drugs to market, to kind of think about that component of, if that company wasn't involved, would this drug have gotten anywhere else?
And then when that publication comes out, I think the general public sees it on a 1-minute news segment, or they read the press release from the company. Again, I remember all the medications and vaccines coming out from the drug companies sort of ahead of print, and to realize it takes a long time for things to come out, but it doesn't take long to buy stock. So I agree with the balance of, we need companies. They were very successful in they are successful saving millions of lives, but it's really important that that peer review process takes a long time, and to realize that you can look at a news article. I always tell my colleagues that it's a valid thing if they link out to the article for you to read, and you should at least read, because then now you have an article that's peer reviewed, but it's being interpreted through a journalist lens, and to be sort of cautious, even in that sense, even as a healthcare provider. So Brindley, what's our regimen? And Dr. Blake, what's our regimen for practical solutions to misinformation?
I would have to say that the regimen for misinformation is really educating others on how to identify credible sources and determine if a piece of information is valid. Additionally, communicating with others and addressing misinformation directly is really important to be able to start these conversations and empower others to challenge misinformation when they do encounter it. I think it's really important to have these conversations in a very non-judgmental lens, especially when you're out in the community and dealing with patients, because no one ever really wants to be source shamed or be critiqued for where they get their information from, because that's not going to create a welcoming environment where you can have an honest conversation about what may be true and what isn't. So really trying to create a welcoming environment. And lastly, also encouraging people to refrain from sharing content if they're not fully sure it's accurate. I think that really a biggest piece of the regimen for today is going to your healthcare providers, especially those accessible ones like pharmacists out in your community, if you're ever unsure if a piece of health information is true, because we could be a huge help in that. So overall, I think that is the regimen for today. So to kind of wrap up our conversation as a whole in this current setting of information overload, we do know it is incredibly important to continue these discussions on misinformation and amplifying credible sources, especially pharmacists, as resources that can provide valid medical information. So once again, I'd like to thank Dr. Caitlyn Blake for spending some time with us today and for giving us some great insight from a drug information lens on this topic.
Yes, thank you, Dr. Blake. Good to see you again.
Thank you so much. I really enjoyed this today.
And for everyone listening, be sure to follow at PharmD.PubHealth on Instagram and Twitter. Turn on those post notifications so you never miss an episode, and smash that subscribe button now on Spotify, Apple Podcasts, YouTube, Amazon Music, wherever you listen to podcasts.